A very warm welcome to you from Equa Marketing. This presentation is brought to you by Equa.com, a leader in digital marketing.
Hello, everyone. Welcome to another amazing episode of Growing Dentist podcast show. Today, I'm excited to have Dr. John Montoya with me. He's a practicing dentist who is also an entrepreneur. He has been practicing for, I believe, 17 years, and he's the founder of Boulder Dental Designs. Doctor, welcome.
Well, thank you for having me. I appreciate your time.
Can you let our viewers know a little bit about yourself, Doctor? Tell us your story. When did you graduate from dental school? I know you are very entrepreneurial, so tell us, walk us through your journey.
Sure. Yeah. So, I went to dental school at Creighton University, graduated in 2001, and after dental school, like a lot of doctors, I ended up getting a few associateships. I went back to my hometown of San Diego, California, and bounced around a little bit from office to office until I found a home. I ended up in a partnership out there for several years, and that was really nice because it got me into a fee-for-service practice, a very cosmetic, occlusion-oriented practice, and I learned a lot going through the years. Eventually, it got to the point where San Diego was just gotten to grow so large that I had an hour and 10-minute commute to work, hour and 10-minute commute home. I only lived 15 miles from my office. It just got too much for my family and I to really appreciate San Diego for what it was for, and we love to be outdoors. And so we went on the search to look for another opportunity. I got out of my partnership in San Diego, and I found a practice in Boulder, Colorado that was very similar to the one that I had in San Diego, and purchased the practice. Doctor handed me the keys. He walked out, I walked in, and we've really been growing ever since. It was in 2008 where I moved to Boulder, which we all know 2008 wasn't the greatest year, but we ended up growing that year, and we've doubled the size of the practice over the last couple of years, and it's still growing. So that's where I'm at today, still practicing clinician. I've acquired another practice, which is an insurance-driven practice, and I'm looking to acquire my third.
That's wonderful. So you made the transition from being a dentist to an entrepreneur. So you really started, you still practice, but what I mean is you kind of also got good at building a business.
Yeah, too many times doctors spend too much time in their practice and not on their practice. This is a small business that you have to constantly learn and grow at. And you don't get a lot of business training in dental schools, so there's nice opportunities to listen to podcasts, and there's a lot of stuff online and training and those sort of things to help you run your business as a business. So I've done a lot of work on that personally and over the years, and have a lot of great mentors. So it's really good to look at your business as a business and not just a practice.
Right. Makes sense. Tell me about some of the challenges you faced in your practice that you kind of found creative solutions for. I know you came up with a dental plan, but what are some of the things that you noticed over the last, 17 years as things that dentists struggle with?
Dentists struggle with a lot of things in business that, they need education on. One is, marketing the business. Again, we don't get a lot of training in marketing, so doing a lot of research and trying to bring those patients in and keeping those patients in the practice has been a challenge over the years. Obviously, staff, if you talk to any dentist out there, staff relations and keeping staff and keeping staff happy and going forward for staff retention is a problem. And then dentistry, learning and growing in the field of dentistry. It's always changing, and now with all the digital implementation in dentistry, you've really got to stay on top of that, or you'll be left in the times. And then, one thing that is always going to be a challenge is dealing with benefits and people's insurance plans and those sort of things, because that's always the game that dentists have to play, whether you're in network or out of network. You're going to be dealing with dental insurance at some point, throughout the day, and that's an ongoing challenge as well.
Right. That's interesting. So, so you've learned a lot. So I guess on the marketing side, really it's about getting the right people and keeping them happy and letting them stay with you for a long time, or actually making them want to stay with you for a long time. So the customer experience is really important. How you position your practice is really important. How you brand your practice is really important.
Yeah, absolutely. I mean, first and foremost, patients need to know who you are and where you are and how to get a hold of you. Those are the main things, because some doctors that don't have the advantage of, being in a single building with great traffic exposure. I mean, some people are in professional buildings or tucked behind somewhere, and so they have to get the word out, okay? And then, what kind of word are they getting out? Are they going to bring patients in through some sort of a discount? Are they going to bring them in towards some sort of service that they want to focus on? And how are they going to market that? And then the other thing is that they have to track their marketing. How are they going to know if it's working if they're not tracking it? And there's a bunch of different ways to do that. One was relying on your front desk to write it down, but other is tracking software and different phone numbers and recording calls and those sort of things, so you can actually say, hey, I sent out, for example, 5,000 mailers, right? And it cost me arbitrarily $2,000. We got 5 patients off of that because we used tracking number and to know that they called off of that mailing. They came in, and you can pull them up in your dental software and say they spent $15,000 between all of them. That's a really good return on your investment, but unless you knew that those people came from your mailer, you'd never know how well it's doing. So you really got to be on top of tracking those things, or you may stop something that's really working or keep going on something that's not.
Right. Makes sense. Yeah, I was just thinking out loud. I do think tracking is really important. So, like, we track calls for our clients. We have doctors, physicians and dentists and so forth, and we generate around 500,000 phone calls. And you're right. There's a lot of people who really don't know, where they're getting the patients from, and sometimes they might spend $10, 10 times more to get patients one way than some other way. So it's really, really important for doctors to know, where the patients are coming from and how the patients are coming, so they can really zoom into those types of marketing activities that produce the best return on investment. And in some cases, I was just talking to a doctor from England today, and he was spending £500 per patient. He's a spine doctor, and he was actually making, £400 per patient. I mean, that's making as in not profits. That's just revenues. So he's actually losing his shirt on it, and sometimes it's nice to know that, so you're not losing your shirt on your marketing. So I think it's a really, really important point you made, Doctor.
Yeah, you want to track it and see how much those patients are costing you to bring in, and if it's worth it in the long run. If you don't track it, you're just throwing money out there, and we don't like to do that. It's not a good plan.
Right. The other thing is, in the old days, you can ask patients, but now those are not very effective, because a lot of times people look at multiple things, so they may not tell you what they did last before they called you. So with call tracking, for example, I think people can really, find out, especially dentists, exactly how many calls are coming in from this versus that. That's interesting. What
Yeah,
are the
and a lot
lessons
of
that
the
we learn? Go ahead.
oh, I was going to say a lot of the platforms have that, those metrics built in. So it's getting easier and easier to track that stuff.
Right, right. And the other thing I know in today's technology is people don't leave voicemail. So let's say if you use a tracking software and somebody doesn't leave a voicemail, the system could automatically notify you saying, hey, somebody called, nobody answered, here's the person's phone number, so you can call them back right away. So you're
Yeah.
not missing those leads.
Yeah. Yeah.
Do you use texting with your call tracking? I know some people are now liking to text, so they don't really like to call anymore because let's say I'm multitasking and I'm a mom, I could just quickly send a text to the office, which is just another way of getting a lead. Of course, you don't
Yep.
have to reply to them by text. Is that something you have experienced?
Yeah. Yeah. We use text and email, and then call. We'll send out letters. We run the gamut as far as keeping in touch with our patients, and we want to make it convenient for them to get a hold of us too. So, we're open to all those different avenues. More and more, we're seeing a lot more email responses come in, text responses, inquiries through the internet and through the website. The majority of individuals have a smartphone now, and your websites all have to be optimized for smartphones and easy to navigate, so people can just really find you quickly, find your phone number, find your email, send you a quick message, and then you can get back to them in the same way that they responded to you. If they respond via email, that's usually the preferred method of communication, and you can go back and forth that way. It's really a fun time to be practicing with all the advantages of communicating with patients. It's great.
Right, right. Makes perfect sense. I was going to ask you, when it comes to the customer experience, what do you think is the secret of keeping those patients?
It's multifold. Really, yes, we're in the medical profession, but we're really in the customer service business, and so we all know when we get good customer service and when we don't get less than desirable customer service. So, I think that treating patients as equals, and not, hey, I'm the doctor, you're the patient. People are very educated, and if you get on their level and just talk with them and help explain what's happening with them and help them in the decision-making process, I think they feel more comfortable than just saying, I'm the doctor and this is what you need and this is how much it is and we need to do it tomorrow. The same thing goes for the staff. You need to go now these days above and beyond, because there is a lot of competition out there, and so if somebody comes in and is greeted with a smile and greeted by their first name, and you have different amenities in the office available for them. Like we have heat and massage in the chairs, we have coffee and tea and water and juice available for them. We have sunglasses for the bright light. We use the smallest needles on the market and the most powerful topical that's out there that makes their injections as pleasant as you can make them. So, there's little things that you can do throughout their visit to make things comfortable and make dentistry actually, a enjoyable experience than something that somebody's going to come and dread. The other thing is follow up and convenience. Try and get those patients the appointments that they want. Follow up with them after they have been in your office and had some sort of work done, just to make sure that they're doing okay, or make sure their bite feels all right after doing some work. It's little stuff. It doesn't cost you anything, and it makes a world of impact on the patients. And those are the patients that are going to stay with you. They're going to refer to you. They're going to talk about you out in the community, and kill them with kindness.
Right. Yeah, one of the things I've learned from talking to so many doctors is that the more you treat them like you want to be treated, and the more you listen to them and make them feel like they're being heard, and then help them achieve their dreams, the more they love you and write good reviews for you and tell their friends about you. And the less you treat them like I know better and you don't know as much and you need this and you need this and this is how much it's going to cost, the less success they have.
Right.
Let's talked about marketing. We talked about the importance of treating patients and the customer service aspect of it. I know you solved a problem. You came up with your own dental plan. Can you tell me more? What kind of drove you to even think about it? Like, what was the driving force behind this idea?
Sure. So, it's a couple of facets of how I came up with the plan, and one was to just solve a problem in my own practice. I have a different variety of patients, and some have benefits and some don't. And as my patients would change jobs, or they would lose their insurance benefits, or they retired and they didn't have the option for them, even though we were fee for service practice, we still filed insurance on their behalf and we still maximized their benefits and we did all those sort of things. But patients were used to getting some sort of quote unquote discount, or people would ask me, hey, my plan isn't reimbursing very well. Our renewal period is coming up. What would you suggest we switch to? Or I'm losing benefits. What plans are out there that you can recommend? And as a practicing clinician, we know that, really insurance isn't a benefit for us. They take a while to pay. They deny procedures. They downgrade things. They cut your fees anywhere from 10 to 40%. So recommending that for, some sort of plan for my patient population, just I couldn't do it. I said, there's no great plan out there, but try this, and then call the office, and we'll help you pick the best selection out of the three that you have researched. So as time went on, I thought, well, this is silly. We can definitely do something like this for our patients. Our patients want some sort of benefit, some sort of discount. I want to be able to control my fee schedule, and the insurance companies are getting paid a monthly premium every month. Why can't we do that in our office? So I took a look at it, and I looked at it like like a gym membership. I've got a gym membership. I pay my gym membership every month, and I don't go to the gym, but I have the ability to use that gym anytime I want it. So I thought, I can do this for my patients. They can pay me a small monthly fee. They can get a discount off of my UCR fees. What I'll end up doing is locking that patient into the practice and in a membership, so they're not going to go looking for another insurance plan. They're not going to be looking for somebody down the street. They're getting their needs met, which is some sort of a benefit in the office, a discount in the office. I'm getting my needs met because the patient is staying with me. And then I've also created a passive income stream for the practice, with those monthly premiums. And the patients have been really, really receptive to that, and it's turned into a great thing for our practice. It's been a great marketing tool to bring new patients into the practice. And, we still have our fee-for-service patient population. We still have the patients that are on, plans that we file their benefits for them. And then we have a whole different population of an in-office plan that the patients are signed up for. And so that's really where it was born. Right.
Can you tell me more about the population that seems to be attracted to this plan? The dental plan that's provided by the office. Is it
Yeah.
certain types of people or certain demographics or certain?
Yes and no. A lot of retirees are on the plan that they have a lot of dental needs, a lot of old dentistry in there that's breaking down. They were in a good job with a steady income. Now they're on a fixed income. They probably most of them had some sort of benefit that now is gone, and so that's a very popular demographic that's signed up with the plan. The self-employed, the individual, the sole individual that has their own business or just has a couple employees, they're really attracted to it because they don't have the means to go out and get a dental plan, or it's very expensive, or they can't bring that to the 1, 2, 3, 5 employees that they have. So they're very attracted to the plan. And then just local businesses that are providing benefits for their employees now, and that could be small to medium sized businesses. They're really attracted to the plan. So those are the demographics that we usually see.
Can you tell me about the typical options you have in a plan like this? I assume you have tiers, and tell me like how much does each tier cost, and just in your practice, right? And what are the benefits you would offer?
Sure. So in our office, we have 3 tiers, and that's built into the plan. It's $39, $49, and $69 a month. The percentages go 10, 15, 20 of what they can get off our UCR fees. Depending on any tier that they sign up for, they prepay in advance for their 2 hygiene visits, their exam, their radiographs in the office. So essentially they can use those anytime they want. I mean, if they come in Tuesday and get their cleaning and exam, they can come in Wednesday and get another cleaning. They've already paid for it, so I'm not losing out on that revenue. And it helps the front office fill those holes in the schedule, because they'll call someone up and say, hey, you've got a cleaning to use. If you don't use it, you end up losing it. It's a year sign up, so they have to use that within the year. And if they don't use it, they lose it. Does that answer your question?
Right. Yeah. So let me understand. So you said 39, 49, 59. All 3 options a month, and all 3 options has a certain number of hygiene visits. How many do they get?
They get 2 hygiene visits per year, along with an exam and the radiographs built into that. So really, there's zero barrier to get them into the hygiene schedule, since they've already prepaid for that. People typically don't want to lose something that they've already paid for. So when they say that you have that available in your bank of things, it's really easy for the front office to get people in.
So are people willing to pay $480, because $39 is approximately $480 a month for that package, or do you have to be more competitive in the pricing?
It depends on region to region. I mean, you can play with those figures according to your office. We found that works well for us. But in other parts of the country, it may need to be a little bit lower, and there's some flexibility there with that, and that you have to kind of test your market, and we have to talk with the doctors and see their demographic of people. Here in Boulder, the income level is a little higher, and then patients don't mind paying those premiums, because they're going to be paying similar to that if they went out and got an independent insurance plan on their own.
Right. So the hygiene and the X-rays and the exams are included once 2 hygiene visits, and then they get discounts. So if they are on the $49 plan, they get 15% off, versus $39 plan, they get 10% off, and so forth.
Yeah. So, for example, I mean, if you walked into my office as a new patient, cash paying patient, and you needed an exam radiographs and a cleaning, you'd be somewhere in the $250 to $300 range just for your initial visit. So you were talking about, are they going to pay $480 a year? They're going to be better off by signing up for the plan, because they're going to be prepaying that exam, cleaning, x-rays in advance. That times two, they're going to be ahead of the game.
Right.
Plus
then,
they get discounts on their service.
Right. And the hygiene, you said, how much is it in your office if they were to pay out of pocket?
Pay out of pocket, it's for the exam, x-rays, and cleaning is somewhere between $250 and $300 in my office.
All right. Okay. Got it. So definitely they're getting a deal. Okay. Got it. Now, how many people have signed up for this? I mean, just in your office.
In my office, I'll have to pull the specifics, but we've got a couple of hundred people on the plan between our few locations here. And I'm in the office today working on patients, and we had a patient just kind of walking. He was a walk-in, and self-employed. Him and his wife run a marketing and consulting company. He signed up for the plan for him and his family of four. So.
Right. So you actually can tell them, either you pay for the cleaning and X-ray and exam, or buy the package, and that's included, plus you get one more cleaning. So actually you end up saving money. So that's like an upsell.
Yes.
Right. Once they buy the package, do they tend to be more loyal, or do you have any data on that? Or?
So they stay with the practice, and that's really a great patient retention tool. Because if you can get somebody to buy into you and your office through some sort of monthly program, they're going to stay with the practice. Okay, and this is the type of program that's going to auto renew as well. So, it's going to keep them staying with your program and with your office. I mean, they always have the option to cancel, but a lot of times patients will just let that renew, because again, they're getting that discount. They're getting those cleanings at a discount. So, it's really a win for them. And then you're going to win them over with your customer service and your wonderful staff and your excellent dentistry. So they're going to want to stay with you as well. As you kind of get in towards your retirement part of your career, we all know that, the value when you go to sell your practice isn't with the equipment, it isn't the location, it's the patients. That's the cash flow of the practice. And if you can prove to somebody, hey, listen, I've got X number of active patients, but hey, I have got this amount on a plan that is dedicated to this office, and they're not going anywhere. That's a better sell than somebody that says, hey, listen, my software says I have 1,000 active patients. Well, depending on how you're doing your records, that could be true or that could not be true. It could be somebody that's still coded as an active patient and they haven't been in it 4 years.
Right. Makes sense. You talked about, I know you and I were chit-chatting, you said, like, let's say you have an empty slot for hygiene. You could call somebody who's on the plan and say, hey, why don't you come over? Today I have a slot at 2 o'clock. If you don't use it, you lose it, so might as well use it. So get them back into the routine of taking care of their, getting their hygiene visits done, and also keep your team busy. So that, you said, was one of the reasons you seem to like this.
Yeah, it makes it really, it takes down the barrier of getting people in. And, as a practicing clinician, about 70% of my production comes out of the hygiene schedule. So we want that hygiene schedule full in order for us to diagnose and treatment plan and talk with those patients and, revisit treatment plans that haven't been done yet, and talk about supplemental services. being a business owner, I mean, you want those patients to come in as much as you can and do the services that they need. If they're not in the office, you don't have the opportunity to do the services. So what we want to do is get them into hygiene, be able to get to do the exams, so to be able to do the dentistry. And the front office staff, if they've got holes in their schedule, they can go to their unscheduled list in their software. I mean, all softwares have that in there, but they can also go on into the back portal and say, how many of these patients haven't been in, and they've already been prepaid. Let's start on this list first. Give them a call, get them in, and then we can start on the unscheduled list, because those patients are going to have to come in, spend their money at the time of the visit, and go through all that. So it's a lower barrier of entry for the patient.
Right. Excellent. I know, Doctor, you came up with one because you just wanted to automate all of this, correct?
Yeah, I mean, listen, doctors can do this on their own. This is a thing that you can take a pad of paper and a pen, and you can sit down and you can make a discount plan for your office. That being said, it's a real struggle for the office to keep on top of it. You've got to dedicate somebody to, make sure that people understand what the plan's all about. You have to dedicate somebody to keep track of who's on the plan, who's not on the plan. You got to keep track of, okay, did they pay this month? Did they not pay this month? When's their term coming up? And it just gets into a tracking nightmare. Can you do it? Yes. But what I wanted to do is take the burden off of the front office. I mean, they've got enough to deal with on their own, with everything that goes into the day-to-day running of a practice, to now manage something else, right? So what I wanted to do is I wanted to automate it. The patients sign up online. The patients put in their credit card information. The system collects their credit card information, puts them on a monthly recurring payment. It's really easy patient lookup system where, John Smith comes in, you type in his name, he's updated with his payments. You see when his plan renews, you see what kind of discount he's on, and you move forward from there. So there really isn't any tracking that the front office staff has to do. There's nothing that they have to do as far as educating the patients on the plans, because everything is spelled out online. So to take that burden off the front desk and incorporate something into the office at the same time is a benefit for not only the doctor but the staff, because they don't want something that's going to be complicated and something that they have to manage, and they have to make sure that the payments are being done. It's just easy.
Right. That makes ton of sense, Doctor. If I'm interested in learning more about this plan, I know in addition to using it for your own offices, you kind of let other dentists use it. If I want to learn more about this plan, how would I find out? Should I contact you, or is there a website?
Yeah, you can do either. I mean, you can go to elmsavingsplan.com. On there on the website is contact information, so it's 303-569-9916, or you can email us at info@elmsavingsplan.com. Either way, you'll be able to get a hold of us, and we'll get back to you quickly.
Awesome. So it's a simple way to kind of automate the payments and keep track of it, right? That's really what it is. So you're not manually doing it. But like you said, anybody can do it. It's not rocket science. It's just, you're just making their life a bit easier.
Yeah, we're automating the process for them. Anybody can do it. And you're right. It's not rocket science. It's monthly fees. It's a discount. It's keeping those patients in the practice. Can you do that on pen and paper? Absolutely. But do you want something that's going to run automatically for you and keep track of that stuff on your behalf? provide you with an positive passive income stream, then getting some sort of plan in place that is going to manage itself is a lot easier on the office and the staff and the doctor than trying to do it on your own.
Right. Fair enough. Thank you very much, Doctor, for sharing your insights with us, both as a dentist and an entrepreneur and somebody who had, been doing this for 17 years and who has noticed a few issues and solved it for yourself and others. We will be adding all your contact information in the show notes, so hopefully if anybody has any further questions, hopefully you don't mind if they get a hold of you, Doctor.
Absolutely not. I'd be more than happy to talk to anybody that has any questions or wants any more information. I'm always available, and even if they're not interested in the plan and just kind of want to ask me questions, feel free.
Awesome. Thank you very much. I really appreciate you taking the time. Once again, everyone, thank you for listening to another episode of Growing Dentist Podcast Show. Today you're listening to Dr. John Montoya.